Assalamualaikum warahmatullahi wabarakatuh. I'm Asma Rashidah Idris from Faculty of Business Management UiTM, Cawangan Negeri Sembilan, Campus Rembau. Okay, my topic presentation for today is Aging Population in Malaysia, a conceptual paper on the effect and the challenges. Okay, for the abstract, in the recent decades, the world's aging population is a significant demographic trend which observed worldwide. So this trend is driven by several factors, including declining fertility, advances in healthcare, and also increase in life expectancy. Okay, this implication of this trend vary across different regions and countries. So, in response to this demographic trend, this conceptual study is likely to highlight the effect and the challenges of aging population in Malaysia. The aging population can have crucial effect on various aspects such as productivity, government revenue, healthcare, social security system, and also investment pattern and labour market. Okay, by taking a proactive approach to address the challenges of aging population, so society can better support the well-being of the elderly citizen in future while maintaining economic growth and stability. Okay, for the introduction, okay, aging population can be defined as a demographic change characterized by an increasing proportion or the number of older individual in a population. So it occurs when a median age of population rises over time, usually due to the declining pattern of fertility and also increasing life expectancy. Okay, the aging population measured by looking at the proportion of individual aged 65 and older compared with the younger population. Alright, currently in Malaysia, we are moving towards having an aging population. It is estimated that Malaysia may become an aging nation by 2060, with their people aged 60 years and over surpassing 15% of working population. Okay, in 2020, the elderly population accounted approximately 9.1% of the total population, which is 3.3 million, and it is projected to reach 20% by 2045. Alright, Malaysia Aging Index was 11.7, indicating that there were approximately 12 elderly person for every 100 working age population. Okay, in the meantime, fertility demonstrates a decreasing trend, which is alarming in the most of the country that will likely reduce the number of young age population and will be facing decreasing population in the future. Alright. So over the last 5 decades, Malaysia experiencing dramatic fertility decline around 50% over the period of 1961 to 1930. Okay, this trend continues. It is expected that annual population growth will continue to decline until it reach a level of 0.7% in 2050. Okay, so the fertility rate for Malaysia in 2022 was 1.9 birth per person, which is a 0.87% decline from 2021. Alright. Okay, apart from an increase in the age population, the age are also living longer as evidenced by an increase in the life expectancy. Alright, so this is because of several factors like advance in the medical technology and healthcare, lifestyle, socioeconomic condition, which vary by people or individual in Malaysia. So this issue of aging population, fertility decline, and longevity are interconnected and have significant implication for the societies and economics around the world. which is this trend is very across different region and countries. Okay, so in response to this demographic trend, the study likely to highlight the effect and the challenges of aging population in Malaysia. Alright, this aging population actually have crucial effect on various aspects of the society, such as productivity and government revenue, healthcare, social security system, and social security system, investment pattern, also labor. Okay, so we look at the first one, effects and the challenges. First, dependency ratio and government revenue. Okay, the aging population has implication for dependency ratio, which is the ratio economically dependent population, which is those under 50 and above 65, to the working age population or productive population, which is 15 to 65 years. Okay, as 2020, Malaysia dependency ratio was 49.3, meaning that for every 100 working population, there were about 49 dependents, which is too big. Okay. Okay, this elderly population increases. It actually put pressure on the working population to support the dependent population. Alright. Okay, actually, how they burden, how they affect the aging population actually lead to a decline in working population, potentially affect tax revenue, economic productivity, and growth. Okay, with fewer people in working years, there will be a reduction in labor supply and economic output. Okay, this also can impact tax revenue, which are important source of government revenue. Second, social security system and investment pattern. Alright, social protection system in Malaysia actually will not be sufficient to financially support the aging population. As people live longer, there is a need to ensure sufficient retirement saving and pension plan to support all age population during retirement years. Alright, government and employer actually need to ensure the sustainability of pension system while providing adequate, and they remain financially viable and able to meet the needs and support of the retirees. Alright, actually the financial behavior of the old age people can influence the overall financial stability. We know that old age population commonly risk averse person, which is they tend to shift their investment strategy toward lower risk asset, and they draw down their saving for retirement expenses. Okay, so this pattern actually can have implication for financial market and investment flow. Okay, potentially affecting economic stability. Okay, um, uh, uh, in a paper, in a study, which is demonstrate that gradual decline of the traditional funding sources of the commercial bank in the form of deposit, and the relative increase in the market-based funding sources offered by other financial institutions between 1945 to 2011. The third effect is life expectancy and healthcare. Okay, Malaysia has made substantial progress in improving life expectancy, mainly due to the improvement of healthcare, better access to hospital, medical service, upgrade the income level. Okay, this is the reason why Malaysia improve the life expectancy of the citizen. Okay, so however, these elderly are less healthy than the young population. Okay, hence an increase in the proportion of old age population is associated with the increase in the occurrence of ill health. Some common health condition of the elderly, for example, chronic disease, heart disease, diabetes, okay, mental health, okay, vision and hearing impairment, okay, all these diseases actually will need regular medical checkup, healthy diet, social engagement, and access to quality health care. and infrastructure to support and promote the well-being and the quality of their living actually. So to the the present healthcare system is just inadequate and even inappropriate to service the elderly with their chronic disease and disabilities. All right. So the prevention and the primary health care as hospital-based care involve a lot of cost and public health expenditure for the public health expenditure from the government lah, which is burden both party, which is family member and also policy makers. Okay, and then next is labor market. The aging population has crucial impact on labor market. As the population ages, the size of labor market will likely to decline, and a country experiencing slower productivity. So this is particularly due to a decrease in the number of young people entering workforce compared to elder people. So as a result, there will be a shrinking of available workers and contribute to the labor shortage, particularly in sectors that heavily rely on the younger workers. So this can be problematic for certain industry that needs the young population to operate. The aging population also influence intergenerational dynamic in the labor market. Younger workers may face challenges such as limited job opportunities and slower career growth due to the high proportion of older individuals occupying senior position. So in this case, balancing needs and opportunity for both younger and older workers is crucial for fostering a harmonious and inclusive labor market. Lastly, for the recommendation and conclusion, the age population has its own unique effects and will generate new challenges. To address the potentials and associated with the aging population is for policymaker, employer, bankers need to adopt proactive measure. Okay, this include implementing reform to pension system, healthcare financing, social security program, as well as encouraging workforce participation and promoting financial literacy and planning among individuals of all age groups. Okay. Moreover, in order to adapt to the changing dynamic of labor market, employer can implement age-friendly workplace policy, promoting lifelong learning, supporting flexible work arrangement, and fostering intergenerational collaboration. In conclusion, there is a require a sharing responsibility between government, private sector, non-governmental agencies, and the community. Okay, we will all age and we will all require the service for the age at some point in time. Everybody needs to address the specific needs and challenges faced by elderly populations so that policymaker can propose a strategic planning for the purpose of old age population well-being in the future. Okay, that's all from me. Thank you. Assalamualaikum warahmatullahi wabarakatuh.